Wisconsin's Department of Health Services has announced new enhancements across its healthcare coverage, food assistance, and child care assistance programs in the collection of ethnicity and race information. The state says the data collection will align with the overarching vision of the Division of Medicaid Services Diversity, Equity, and Inclusion Initiative, while also staying in compliance with some federal requirements. Now, federal regulations require states to collect and report information on individuals' race and ethnicity. Individuals, however, are not required to respond to these questions to be determined eligible for programs or to receive program benefits. Data is instead to be used to help ensure that the programs are being administered in a non-discriminatory way and to help identify gaps. The state says the data will support program initiatives, strategies, and drive health policies to address disparities and also help combat inequities across the populations that are being served. Now, keep in mind, race is actually quite common as an intake question when determining eligibility for healthcare coverage programs, because the way you answer that question could change your healthcare coverage options. For example, if somebody identifies as a race of American Indian, they may be eligible for more frequent special enrollment periods on the healthcare marketplace, the Affordable Care Act's private health insurance marketplace, healthcare.gov. But the feds and the state remind us that while these questions about race and ethnicity are being asked and the data is being used to help minimize disparities, they are not required questions when applying for state programs. Starting on June 25th, the state of Wisconsin says applicants and members in BadgerCare Plus, Medicaid, Food Share, Senior Care, Wisconsin Shares, Wisconsin Works, and similar programs will be asked more detailed race and ethnicity questions. They will also be able to select more than one response to accurately report their race and ethnicity information. So under the ethnicity category, for example, we show you on the screen what some of the new options look like, and then what some of the sub options look like once you select Hispanic or Latino, for example. You have your ability to select more detailed replies. Under the race category, they've expanded quite substantially what your options and sub-options are, including listing out some of the Native American tribes in the state of Wisconsin, also giving more options under the Black or African American category, and so on, as we show you on the screen. Now remember, applicants and members are not required to provide responses for ethnicity or race to complete an application or to be determined eligible for benefits. The hope is that by collecting better data on these questions, the state can start building equity and inclusion in these programs.